first of all, oftentimes it's about trying to identify where the problems are in your specific locations, right? And those may vary. And I think to put some catch-all approach to it, it would be difficult. So I see it as a healthcare organization, or even as a community, trying to understand where the disparities are, and then trying to tackle those in the best possible ways with the resources that you have. Right? Not every place and not every group has the same resources that others have. But if you try to identify what resources you have, and you try to identify where those disparities are and those inequities and inequalities in the healthcare that you can provide, then I think that's a good start. And then, of course, there's a responsibility of the citizens themselves. I mean, we as individuals, we should have an interest in both our own healthcare as well as those around us, our neighbors, right? Because that's we as humans, our community. And then, again, from companies like Siemens Healthineers and others out there, we have a social responsibility. And I think that's where we are quite excited about kind of developing new innovations that help drive that. And we have regular conversations with different groups in all of these different types of segments to understand where a company like ours can focus some of our R&D resources and develop innovations that help address whatever those disparities are in the various different segments of the population. About a couple of different things. I mean, diagnostic imaging, there are a lot of different technologies out there in diagnostic imaging. MRI has its own unique characteristics, particularly in the soft tissue visualization. It's a non-ionizing radiation based imaging approach, so it has some advantages, particularly from a longitudinal imaging perspective, unlike some of the other modalities that exist out there that depend upon radiation. However, they're powerful tools. None of the medical imaging technologies or modalities could exist on their own. They all have complementary roles in diagnosis and discovery of diseases, et cetera. So, there's things like computed tomography and ultrasound and X-ray and positron emission tomography, or PET imaging, SPECT imaging as well. And even some optical imaging, et cetera, that exist out there. All of these are diagnostic tools that are powerful in their own right and have a play for certain diagnostic processes. But if I speak a little bit more about MRI itself, there's a lot of development that's happened since its inception, and then and it's kind of gone a lot of different directions. I mean, where we see 5 years ago, we were and we continue to do this. We push the envelope on the power of the system. So at Siemens Healthineers, we introduced, I'm going to miss the actual year when we got clinical FDA approval, but I'll say somewhere around 2018 or so, FDA approval of what's a 7 Tesla system. This is the most powerful clinical system that exists out there today. What it allows us to do is it allows us to see things that we've never been able to see before. The level of detail is just amazing. That being said, it's a system that from a number of different characteristics, from the size of it to the power of it to the easy utilization of it, is not one that fits in that classic democratization story. Instead, what if we think about broadening access? So that one's that can provide a lot of information and detailed information, and I think pushes the envelope. But where we see is more recently as a migration towards more smaller systems, maybe some point of care type of strategies, or maybe whole body imaging systems. We at Siemens Healthineers introduced, got FDA clearance just last year for a new system called the Magnetome Free Max. It's a system that sites in smaller locations. It's got a more open bore to it, so a larger opening that allows us to get larger patients. So that's a really valuable piece for us, because we thought, hey, there are some of the most critically ill patients are sometimes the largest patients, and obesity is, for better or worse, it's a growing epidemic sorry for the pun there, but it's an epidemic here in the United States, where we see larger and larger patients, and the average size of the patients average size of Americans is going up. So accessing or being able to put those patients into an MRI scanner is an important piece of the puzzle for us, and we think that developing technology to address the limitations of those patients is an important piece, but also being able to get systems to locations and being able to site them in locations that may have been restricted in the past is an important piece. But you'll also see some exciting developments out there in focused or kind of dedicated systems for very specific applications. I think that there's a nice drive there from the MRI innovation perspective, and it's an exciting time to be working in this space, to be a leading vendor in the development of MRI innovations, because there's still a lot of opportunity there and a lot of direction, and again, there's still a lot of people out there that don't have adequate access to it. So